Hi, my name is Paul Fearon. I'm a general adult consultant psychiatrist based in Dublin, Ireland. I'm clinical professor of psychiatry at Trinity College Dublin, and I'm the medical director of St. Patrick's Mental Health Services. In terms of challenges that we faced in St. Patrick's, they were similar to all of the services around the world when coronavirus hit our shores. First of all, we had to respond quickly. Secondly, we had to decide what our priorities were as a service. In our case, we had three priorities. Number one was to keep our service users and staff safe and as free as possible from infection. Number two, we had to do this while at the same time continuing to treat as many people who needed our services as possible. And number three, in order to do that, we needed to remain open and viable as an organisation in order to do that. In terms of the main ways we've addressed these challenges, apart from physical distancing and hand and respiratory hygiene and limiting footfall into our campuses, probably the most innovative thing we've done is we've developed a home care service. So we looked very carefully at what we traditionally deliver to physical inpatients, and they would include nursing input, ward rounds, multidisciplinary team meetings, an initial assessment and care plan, the prescribing of medication. And we found solutions to all of these remotely. In terms of prescribing, for example, we were able to get the details of the person's local pharmacy or chemist and fax their prescription to them for collection locally. And that included both initiating medication, but also any changes in medication. We were actually very lucky in many ways that some of the infrastructure we needed to do this successfully was already in place. So, for example, we had electronic health records that we set up about 2.5 years ago. So by the time the crisis emerged, we were already up and running and very well used to using electronic health records. We were very early in adopting video-enabled technology. In fact, even before the pandemic, we were delivering some cognitive behavior therapy remotely, and we were also piloting it in the adolescent service. So we were able to just extend a lot of these naturally in order to provide a home care service. And currently, as we speak, we have 91 patients to whom we're delivering this service remotely, and that compares to 150 physical inpatients. So I think it's very important for services to be proactive in the face of this pandemic. We know quite a lot about coronavirus in terms of how it operates, in terms of how its transmission, and we know most of the things we need to be doing. So when you marry that with what your service's aims are, it is actually possible to come up with a strategy and a plan. Obviously, these plans in these times need to be adapted, and it's very important to be agile in one's thinking and indeed in one's imagination. And I suppose another thing I'd add in there as a last thing is we need to always be listening to our patients and our service users about what they want, because after all, at the end of the day, regardless of whether we're in COVID-19 times or not, our basic function is to be providing the best service possible for our patient that we're seeing. And COVID-19 doesn't change that. It may change the way we deliver our services, but it doesn't change the fact that we should be striving to provide an excellent service at all times.